Welcome, everybody. Thanks for coming today. My name is Chris Richmond, and I'm with ICF. And like Kate said, today we are focusing on project-based assistance and conventional public housing for elevated blood lead levels. So we did train for tenant-based rental assistance a couple of weeks ago. If you missed that, that recording is going to be posted soon. But today we are focused on project-based assistance and public housing. So as I mentioned, my name is Chris Richmond. I'm with ICF. I have been with ICF for about 23 years now. Before that, I did work in local government in Northern Illinois. And I focus on the lead safe housing rule. I also do a lot of training and technical assistance for the home program. I'm starting to get into home ARP, Section 3. I'm accompanied today by my colleague, Les Warner. Les, do you want to say hello?
Sure. Hi, everybody. I'm Les Warner. I've been with ICF for 15 years at this point, and prior to that, I worked at the state level, headed a state program, was there for 20 years. And I also work on a variety of programs, CDBG, home, URA. I'm also working on some disaster work. I think that's it.
Thanks, Les. So Les and I will be trading on and off. You'll hear both of us and see both of us throughout the afternoon. And then we're also fortunate enough to be supported today by 4 HUD staff. Actually, we only have 2 names on here, but we have Bruce Haber, Karen Griego, Flora Chavez, and Barrett Fisher from the Office of Lead Hazard Control and Healthy Homes. So they'll be available to us to answer questions or things that we're not quite sure about. So we'll call on our HUD staff to help us support with that. So if we were all in a room together, I'd ask you to raise your hand so I could get a good sense of what kind of experience you have. Well, because we're on a webinar, we're going to set it up like a poll. And we're going to try to do these polls fairly quickly because we have a number of them. We got a lot of information. So they'll only be open for probably about 20 seconds. So if you could let us know what your experience is with the elevated blood level requirements, and then please hit submit after you choose where you are. All right, Kate, we can probably close that. All right, so we have a good mix of people. About half of you, those of you who responded, we have about a third that said they're new, about a third that said they have a little bit of experience. Very few people actually claimed that they know all the steps to the process, and then we had a few that maybe couldn't quite figure out how to work that poll yet. So just a couple training goals and what we're trying to cover today. We have a really short time. We only have 2 hours. We have so much material. We're going to do a super high level of the lead safe housing rule. Just a couple slides just so that everybody's on the same page. And then we're going to dive into how do you respond if there's an elevated blood level child identified in your HUD supported unit. So we're going to talk about some key definitions. We're going to go over some available resources. There might be some resources you're not familiar with, and we'll show you those. We'll show you the updated website and some other resources to help you get going. Right, so just so everybody knows, we're trying to keep everybody on the same page. We're going to go over some basics of lead. So where does lead come from? Well, lead is a naturally occurring element. It's found in all parts of the environment, including dirt, air, and water. In the past, lead was used in gasoline. It was used in foundries, mining. Children are often most exposed to lead in their homes. So the most most common that they're exposed is to lead paint in their homes, and they were in homes that are built before 1978. And lead was first used in paint prior to the 1800s, and this was because it made the paint more durable, it gave it a better pigmentation, acted as a drying agent, and it really made the paint resistant to mildew. So you'll see it in kitchens, bathrooms. It's really popular to be used in those areas. Lead is also found in water that's pumped through lead pipes and plumbing fixtures, and then also in certain imported items such as clay pots, toys, jewelry. It can be in batteries, ammunition, and even cosmetics. So lead was banned in residential paint in 1978 by the Consumer Product Safety Commission. That's why we say that the lead safe housing rule applies to units that were built before 1978, because after 1978, lead was banned in residential paint. So who's at risk? Well, everybody's at risk if lead is inhaled or ingested. But children absorb more lead than adults, and their nervous systems are more sensitive to the effects of lead. So lead exposure, also to pregnant women, can result in exposure to the developing baby in the womb. So how do children get lead in their blood? Well, a lot of it is hand to mouth, so they're crawling around, they're crawling on the floor, there might be dust on the floor, or there's contaminated soil, and they're putting their hands in their mouths. That way, it's possible they might be eating paint chips, but I don't know about you. If I saw paint chips on the floor, I'd be sweeping those up, and my baby would not be in the paint chips. But more often, it's crawling around in the dust. And the body really confuses lead with calcium, so it stores it in the bones. And so as an effect, we have decreased bone and muscle growth. It damages the nervous system. There can be kidney damage. There could also be behavior problems, hearing loss, learning disabilities. So lots of ill effects that can happen for a child who has an elevated lead level. The EBLL, that's what elevated lead level stands for. It's preventable through primary prevention, removing those exposure sources. And then how do we tell if someone has an elevated lead level? Well, medical health care professionals can check for lead poisoning with a blood test. So the focus of the webinar is really the amendment that came out in 2017. But again, we just want you to understand the general lead rules before we dive into the 2017 amendment. So PHAs and organizations that are administering project-based assistance programs should be familiar with these general lead rules because these have been in place since the year 2000. So there's two federal programs that we're going to discuss today. The first is HUD's rules at 24 CFR Part 35, and then we have EPA's rules at 40 CFR Part 745. And so CFR stands for the Code of Federal Regulations, if you're not sure what that term meant. And then you will always find HUD's regulations at Title 24, and you're always going to find EPA's regulations at Title 40. So first we have our Subpart A. This is our lead disclosure rule. We'll have a couple slides that will talk about that, but that's disclosing whether the owner knows if there's any lead in the unit or if they don't know if there's lead in the unit. And then we have our Subpart B, our general lead safe housing rule regulations and definitions. Today we're going to be focusing on Subpart H, project-based assistance, and Subpart L, public housing. This is what the lead safe housing rule requirements are. And then we have Subpart R. This is the methods and standards. So Subpart H is what are the requirements, and Subpart R is how are they going to be carried out. And then we have our EPA requirements. You'll see that there is also a lead disclosure rule identified here as Subpart F. That's identical to what you see under HUD's requirements. So it's word for word identical, the same rule. And then we have our Subparts D, L, and Q, our lead-based paint activities. This is who's going to do that work. What are the standards and the qualifications for carrying out abatement or inspection? So up above, it was what do we need to do? How are we going to do it? And this D, L, and Q is really who. What are those qualifications? And then the last requirement you see on here, subparts E, Q, and Q, this is the renovation, repair, and painting rule. You might hear it referred to as the RRP rule. That really minimizes exposure to dust, and it emphasizes safe work practices. So you'll hear us talk frequently, if any lead intervention has to happen, they need to be trained in RRP, or they might need to be trained as abatement firms or abatement workers. So you'll hear us use that terminology, but when we say RRP, that's where this is coming from, the subparts E and Q from the EPA regulations. So project-based assistance, or PBAs, you'll see that on our slides, provides federal rental assistance, and this is tied to a residential property with a specific location, and it remains with that particular location throughout the terms of assistance. And so for project-based assistance, you are following subpart H of the requirements. We do have a number of different programs listed here: project-based rental assistance, project-based vouchers, continuum of care programs. It's not an exhaustive list, but these are the ones that we typically see administering project-based assistance programs, and you would be following subpart H for that. And then for our public housing, it provides public housing programs under the 1937 Act, and this follows subpart L. And so we are combining both of these subparts together. The requirements are a little different when we go over the general rules, but when we get into the reaction and what we need to do for EBLL, they're pretty much the same. So here's a couple definitions to keep in mind as we get started. There is a handout. Let's see if I can find our definitions handout. So the slides and the handouts were made available to you. You should have received a link for that, and perhaps Kate, you can put the link to the materials in the chat in case somebody didn't see that in the email that was sent to them. But we're going to be referring to definitions throughout the training, and you can always go back to this document. You can download it. It's available to you. But just a couple definitions. We have target housing. This is any housing that's built before 1978 with some exceptions, and we have those on the next slide. We have lead-based paint. This is paint or other surface coatings that contain lead that's equal to or exceeding 1 milligram per square centimeter. And then we have lead-based paint hazards. You're going to hear Les and I talk about this quite a bit. So lead-based paint hazards are any conditions that cause exposure to lead from deteriorated lead-based paint, from dust, from soil, or from friction impact or chewable surfaces with lead-based paint and the associated dust lead hazard. So just a couple definitions here. You can always go back to the regulations, or you can look at the nice easy handout we have provided for you. So as I mentioned on the last slide, there are some exceptions of when you do not need to follow lead safe housing rules. So we'll go over a couple of those. The first is any property constructed on or after January 1st, 1978. So remember, lead was banned in residential paint in 1978. And so that's why any property constructed on or after January 1st, 1978 is exempt from the lead safe housing rule. You do want to document your files if there is an exemption, because HUD just doesn't want to make, they want to make sure you just didn't forget to check this. So you could have in your file, a checklist of what's exempt, when it could be exempt. You could check it off, sign it, and include it in the file. If you are working with 0-bedroom and single-room occupancy units, those are exempt unless there's a child that's residing, a child under the age of 6 that's residing or is expected to reside in the dwelling unit. Also, housing that's exclusively for the elderly or residential property that's designed exclusively for persons with disabilities, those are also exempt. The exemption does not apply again if a child under the age of 6 is residing or expected to reside in the dwelling unit. We quite often have a lot of confusion around housing for the elderly. This is housing where only elderly are allowed to move in. It's not a single family unit where it happens to have an elderly household that's residing there at the time, and then the next family that moves in could be any household. This is housing where only the elderly are allowed to live, or housing that's exclusively for persons with disabilities, then they would be exempt. We also have properties that might be found to be lead-free. This was done by an inspection. It's been properly documented that all the lead-based paint was identified, it was removed, and clearance has been achieved, and the owner has the proper files and documentation to prove that the unit is lead-based paint free. If that's the case, that can also be exempt. These others that we have on here are really just for information. An unoccupied property that's to be demolished and to remain unoccupied is also exempt. Emergency repairs, rehab, doesn't just for a painted surface. We're not really dealing with these right now because we're talking about occupied units, but we just wanted to make sure you were aware of what all the exemptions were. Here's a couple more key terms. Again, these can be found on your definition handout. We have a visual assessment. There's going to be times when a visual assessment might be necessary. It's an inspection to identify deteriorated paint chips, dust, and other debris. It's also used to determine if any previous hazard controls are still intact. So this is just what it says, it's a visual assessment. So we are looking for deteriorated paint. I'm not able to identify if that paint has lead in it or not. I'm only looking for deteriorated paint. So a visual assessment done by someone who's trained as a visual assessor. That's a free online HUD training. We have links later on in the materials to show you how to access that training. We also have a risk assessment. This is an inspection that's following a protocol. It's using chemical testing or an XRF machine. We have a couple slides later on that'll show you what an XRF looks like, and that's identifying lead-based paint and lead-based paint hazards. So a risk assessment done by a certified risk assessor, identifying these 4 types. That's what we saw on the previous slide. This was deteriorated paint, dust, soil, friction, impact, and chewable surfaces. So that risk assessment is identifying if there's lead in the unit, and they're also identifying hazards. They are providing a report that gives you recommendations on how to address those hazards. And then you'll hear us talk a little bit about clearance. That's an inspection that's done after any lead hazard reduction work is done. That is a combination of both visual and quantitative environmental evaluations. It's done by a risk assessor or a lead inspector. If there was abatement work done, if there's non-abatement work done, it's done by a risk assessor, a lead inspector, or a sampling technician. This is just a really high-level slide that shows you the key steps. We're going to go into a little more detail about some of these, but this one is for public housing. And you'll see we have the same key steps for project-based assistance too, but the differences that you'll see will fall under looking, treating, and maintaining. So we're going to have our disclosure. We're going to be looking using that treatment of either of a paint inspection and a risk assessment for public housing. If we found hazards during that risk assessment and paint inspection, we're going to be doing interim controls. If there's a modernization program in place, then we're going to be doing abatement. After that work's done, we're going to be doing clearance to make sure that the unit is lead safe. Then we're going to be doing notifications. This would be a notification of the evaluation that was done, as well as notification of lead hazard reduction activities. And then we have ongoing maintenance requirements. You'll see same key steps here for project-based assistance, but you'll also notice project-based assistance is split depending on the amount of funding per unit per year. So if you're working on project-based assistance, you're going to want to pay attention to which category do I fall in. But you'll see same disclose, look, treat, clear, tell, maintain. The looking is a little different. So for less than 5,000 per unit per year, we're doing a visual assessment. And if it's more than 5,000 per unit per year, we're doing a risk assessment, lead inspection. And then for treatment, we have a lower type of treatment for less than 5,000 per year. We're doing paint stabilization. more than 5,000 per year, we're doing interim controls. So we'll go into these a little later. Oops. Okay, so I'm just going to do real high level of disclosure. Disclosure has been in place since 1996, so again, not a new rule. This should be provided for all pre-1978 for sale and rental units. We are really highlighting rental units today. If you're not really familiar about disclosure, we do have a handout here. This just really gives you the background of where disclosure came from. It shows you the pamphlet. The pamphlet is available in multiple languages off of the EPA and the HUD website. So if you have populations that have different languages, you can access this pamphlet in different languages. So the owner or the lessor is providing that pamphlet. They're providing any known information about lead. If there is known information, they are also providing any records. And so those records might be copies of evaluation reports or copies of notification reports that have been provided in the past. And then they're providing the proper disclosure form. This has to be done before any contract is signed. It can be signed at lease timing. I mean, it can be signed at the same time the lease is signed, but it does have to be signed before any contract is signed. And it does need to be signed by the tenant. So if you are renewing a lease, so the first year the family moved in, they received the disclosure notice, they received the pamphlet. If it's the second year that they're living there, you're renewing the lease and nothing has changed about the unit, there's no new information about lead, you do not need to provide another new disclosure notice. So this is the wrong notice, this watch out for lead-based paint poisoning. HUD sees this quite often in files. This is not the correct notice. This one that you see here on the slide, the disclosure of information on lead-based paint or lead-based paint hazards, this one is the correct notice. This is available on both HUD and EPA's website. We do have the links there for you. So you can see there's areas where they check whether they know or don't know if there's lead. If they do know, what are the records? They identify what those records are. So you need to make sure that you're, as a PHA, that you're using the proper disclosure notice for project-based assistance, that the grantee is working with their owners to know what is the proper disclosure notice and that those are being utilized. So if you are working in a state that is Rhode Island, Massachusetts, or DC, I'll repeat that again, Rhode Island, Massachusetts, or the District of Columbia, there is a modified disclosure form, so you do want to check with your state to make sure you're using the proper notification form. And again, this is just a real high-level summary. I really like these summaries. We have one for public housing. We have one for project-based assistance. This is where I like to go to try to get my head around what are the rules, what am I following? And so you'll see here, we have our disclosure, we have our evaluation, this is our looking, how are we treating it, what is our notifications and our clearance, and our ongoing reevaluation. And then for project-based assistance, you'll see that it's split here. So it's on the left-hand side, it's up to including 5,000 per unit per year, and on the right side, it's over 5,000 per unit per year as to what the general lead-safe housing rule requirements are. But we're really going to be focusing our training on the elevated blood lead level responses. So again, just wanted to give you a super high-level overview so you were familiar with what the lead rules were in general, and then we'll be diving into the EBLL requirements. So that's my last slide here. Can I turn it over to you, or is there any questions we want to identify?
I don't believe so. I just checked a moment ago. No, the Q&A is empty, so we can just move right ahead.
Okay, great. Thanks.
All right, so we have a few more things to deal with in kind of covering the basics about lead and lead regulations themselves, and then we're going to move into talking about dealing with an EBLL child, a child with an elevated blood level, and the steps, the actions that we're going to take on this. So Chris went through the federal requirements, the HUD, Lead Safe Housing Rule, but we want to also remind you that the EPA Renovation, Repair, and Painting Rule does also apply. And so there's some specific requirements for contractors. There's a disclosure that is specific to contractors under the EPA rule. And included in the resources, there is a handout, which I'm showing here. And so just some key differences. I'll just reference you back to this handout, but I wanted to just point out that in most cases, the HUD Lead Safe Housing Rule has a little bit more stringent requirements. So there are differences between the EPA and the Lead Safe Housing Rule on things such as the evaluation techniques that are going to be required for this. Also important to note on the prohibited work practices, the Lead Safe Housing Rule includes all of the three that were included under the EPA, but there are also 3 additional prohibited work practices. Also, the de minimis levels are different between the EPA and the Lead Safe Housing Rule. And then we have some differences about testing, and also Chris was talked about notification. We're going to talk a little bit more about notification as we go along. And so just make sure that when you are working with contractors, that they understand that with your funding, you are going to be triggering the Lead Safe Housing Rule. And so we need to make sure that contracts, agreements, that folks understand what requirements are going to apply for them. So before we move forward, we're going to do a quick knowledge check. So Kate's going to open up our poll. We're asking you to vote kind of quickly. We're trying to speed these up a little bit. So our first question here is, where are lead-based paint hazards found? Is it the dust? Is it the soil? Is it deteriorated paint, or all of the above? If you'll go ahead and indicate your selection and then hit the submit button. All right, our poll is ended. We should have results here in a moment. All right, so great. Almost everybody got this correct. It is all of the above, and we're going to be talking about some of the steps that we're going to take, particularly when we have a child with an elevated blood level, to try to determine where are those lead-based paint hazards found in this unit or in the overall environment. So we're going to be talking as we go along about having the right staffing, the right certifications in place. And so as part of this, you as an administrator, whether you're a public housing agency, or in some cases we might be talking about owners, needing to make sure that they have appropriate firms in place. So if you're required to follow public procurement requirements, then you would be seeking out those firms and needing to go through issuance of a request for proposal or request for qualifications. And as part of that process, then you'd make sure that you reviewed and saw that they had appropriate licensure and certification in place. And that's going to be based on the level of evaluation that's going to be required. So we've talked about, and we'll revisit on some of these. Some things will be done as a visual assessment, but for instance, on our ongoing recurring re-evaluation, we're going to be working with a risk assessor. We're going to need clearance technicians when we are going to clear work that has been done, and of course we'll need qualified contractors. So we've provided a link here for the HUD guidelines on this. And then you'll also see with the EPA, we have resources to identify where there are certified firms in your area, or also where there are training programs. So you might have a contractor that you've worked with your program that is not yet certified. You could route them to the RRP training providers so that they could get that certification in place. A couple of other resources here. For many of you, you're going to be working in a community where that local entitlement, whether it's a CDBG or home program, is currently operating programs working in compliance with the Lead Safe Housing Rule and would already have identified local contractors with the appropriate certification, clearance technicians, those sorts of things. So that may be a good option to contact those grantees, and we've provided a link to be able to identify those grantees in your area. And then also in cases where there is a lead-based paint hazard control grantee that's receiving funding, they would also have have identified resources in your area, and they might be a good linkage. So we provided a contact list to be able to determine whether those resources are in your area and who you would contact on that. All right. So I want to talk a little bit about the levels of evaluation. And so for visual assessors, and this is where they're simply doing a visual assessment looking for signs of deteriorated paint surfaces, dust and debris. So they're not testing to determine whether what they're seeing contains lead, that it's lead-based paint, but a visual assessment is required as part of our public housing, and we'll be talking about in cases and ongoing maintenance. In this case, this could be completed by an owner or an owner staff or the grantee staff if they have the appropriate certification training in place. And the good news is that there's an online visual assessment training that's available. We've provided the linkage here. So that is something as part of, we're going to be talking later about planning ahead, making sure that we have appropriate staff in place. This would be a resource to get the appropriate training and certification for staff that are going to be responsible for those steps. So Chris showed you the charts for both subpart L and subpart H, and talking about ongoing maintenance. So we're wanting to make sure that throughout the period where we have continued occupancy, where we continue to have investment of public funds in these units, that they continue to be safe for occupancy, that there's no deteriorated paint, or in case where there was some interim controls that were done earlier, we want to make sure that they haven't failed or been damaged or maybe removed on that. So our responsibility, depending on whether this is a PHA or whether it is project-based assistance, is going to be either the owner or the PHA itself. And let's see, we have out. Let's see. Here we go. The designated parties that Chris showed you a little bit earlier. Just wanted to reference you back to this, that this is where you could look on responsibilities on this. And I will just mention that when we have an owner that is responsible, you as the grantee that's providing that project-based assistance will oftentimes have some oversight responsibilities to make sure that that owner is actually completing the processes that they're responsible as part of that. So as part of our ongoing maintenance, we want to make sure that that visual assessment is being done and it's being completed by somebody who has that certification training in place. And as part of that, when we determine that there are new or deteriorated lead-based paint hazards, then we're going to make sure that we respond to those. So we're going to make those required repairs, might include those failed encapsulations or enclosure. And then, of course, we're going to be doing clearance as part of that. And then our final step on this is always providing written notice. And part of this, we're also then asking residents to notify you when they notice any deteriorated paint or any failure of these enclosures or encapsulation. So as part of that written notification, a lot of folks will include that as part of their lease process, so that we're encouraging them to also be some eyes and ears on that property in their unit to make sure that they let you know when they notice something that needs to be addressed. So the timing on this, that visual assessment, needs to be done each time that there was a unit turnover, and also on an every 12-month basis. So if we have an ongoing tenant that there's for a number of years, we not only will have done that visual assessment before they moved into that unit, but we're going to have this every 12-month process to make sure that that unit continues to be safe for their occupancy. Also have some reevaluation requirements, and if you look at our summary, you'll see, let me get my little pen here. So we have a periodic reevaluation process when we have units that are more than $5,000 per year, where we're going to conduct this within 2 years of any hazard reduction activity, and then we would repeat that again. So we're going to make sure that we have a unit that has been cleared and continues to be safe. Under our public housing units, we are going to require, again, 2 years after that lead hazard reduction activity, and then it's going to be repeated after that. So we have 2 consecutive reevaluations to make sure that we have successfully addressed those risks. All right, so with that, we're going to move into talking about how we are going to deal with protecting occupants when we have a child that has tested and we found to have an elevated blood lead level. So there was an amendment made to the lead safe housing rule, 24 CFR Part 35, that applies to both subpart H and subpart L, and this requires a set of protocols that are going to be followed in the event where we have a child with an elevated blood lead level. So we have some additional definitions that we need to cover here. I'll mention again, we do have a handout that lists our definitions, and I think that'll be a handy reference tool for you. So you're going to hear us talking about an elevated blood lead level. So of course, knowing what that is, what the threshold on that is going to be important. So we consider a child to have an elevated blood lead level when we have a confirmed concentration of lead in the blood. This is for a child that is under 6 years of age, and this is when it's equal to or greater than 5 micrograms per deciliter or higher. So that's our threshold to saying this child, based on this concentration of lead in the blood, we're going to consider them to be have an elevated blood lead level, and that's going to trigger us taking further action. So the index unit, when we use that term, is referring to that housing unit where the child with that elevated blood lead level resides. But we're also going to be talking about looking at other units within that property, and we're referring to them as other covered units. And those are going to include where we have children under the age of 6 that live there currently or expected to reside, but it's specifically when we have federal assistance in those units. So if I have a property where I have project-based assistance that's being provided for some specific units in that, there may be other federal assistance in other units that I'm not providing. So this will oftentimes require having a conversation with the owner to determine, are there other covered units that are being funded from some other federal source of assistance in that. We're going to be talking as we go through about the conducting an environmental investigation when we have a child with an elevated blood lead level. And so this is a full risk assessment, which we're pretty familiar with, identifying where we have lead paint that is presenting a hazard, but it also includes then interviews and other testing, trying to determine where other environmental factors might be that would be leading to this elevated blood lead level for the child. So it's not limited only to the unit itself. As far as the designated parties, and again, this is who's going to be responsible for this. For public housing, it's going to be the public housing agency that will be responsible. But for project-based assistance, it is the owner that will be responsible. And of course, there may be some oversight responsibility to make sure that that's happening. So as part of this, I wanted to note that there is a resource. There's an owner's guide for responding to and reporting when you have a child with an elevated blood level that's in a unit, they're under the age of 6, that I think would be an important resource for you. And we're going to be pointing out a number of resources as we go along. At the end of the training, we also will be highlighting where to find those resources for future reference. So the amendment was made to the lead-safe housing rule concerning elevated blood lead levels back in July of 2017. So it's obviously already in force. And what this did was put in place that definition for an elevated blood lead level. It lined it up with the then CDC definition, which was 5 micrograms per deciliter, and it added in language so that in the future, as the CDC threshold changes, that HUD has the ability to align with that. So the CDC has actually lowered their blood lead level to 5 micrograms, or I'm sorry, to 3.5 micrograms per per deciliter, but currently we are still going to be functioning at the 5 level on this. So stay tuned on that to see if there are changes later on that. So what the amendment does is sets in place a series of protocols that when we have a child that is found to have an elevated blood lead level, we're going to have standard actions that are going to be taking place. So first off, this enhanced risk assessment that we mentioned as our definitions of being an environmental investigation, where we're trying to determine what's the source of this elevated blood lead level. How do we address this to try to protect that child? As part of that, it will also then have this requirement for every assisted unit in the building that's occupied by a child under 6 years old. So that's when we talked about other covered units in that property will also be included in our standard steps in trying to make sure, are there other units in this structure that have federal assistance, that have children that could be at risk of the same hazards that our child in the index unit might be facing. And then as part of that, we have some additional notification that we're going to be talking about. So we're going to be notifying HUD when we have identified where we have a child with an elevated blood lead level. And we'll talk a little bit more about those details as we move forward. So let's pause for a moment and take another knowledge check here. So Kate's going to open those up. And our question here, it's a true or false. If that designated party complied with all the federal rules, do they still have to follow any further state requirements or other state requirements that may have been imposed? True or false? Is it just the federal rules, or would it also include state requirements? If You'll mark your answer and hit the Submit button. All right, the poll has ended. Let's see how our results came out. All right, so almost everybody got this correct. So the federal rule really sets the minimum standards, but as we see in most of our federal programs, state and local rules, health department rules can be in place that are more stringent on that, and then you're going to have to follow the more stringent on that. So if you have an overlay of state and local requirements that are more stringent, you will have to comply with those in addition to the federal requirements. So let's talk about when we have a child with an elevated blood lead level in one of our assisted housing units, what those steps are going to be. So our first thing is to make sure that we verify that we actually have an elevated blood lead level. So sometimes we may have, a call from the parent saying, my child has been identified, but we need to be able to make sure that that confirmation is coming from a healthcare provider or the public health department. And so depending on whether this is a PHA or a project-based project, the owner or the PHA is going to need to be seeking that verification. So we need to, sometimes that will come to us from the public health department, so we would have that immediately, but we will need to be reaching out, if we don't have that, to the healthcare provider or the health department to get that verification. It doesn't have to be a written verification, so that could be confirmed based on a phone call and then notation placed in the file. So there is a resource here, a documentation to be able to use on the EBLL verification, and so that checklist could be used as your way to be able to provide that file documentation. You'll notice, and I really want to point out on this prior slide, the timing on this is really important. So we want to immediately get moving on this, and so the requirement is that immediately you would take action to get verification on this. So if you're having initial difficulty on getting that verification in place, you need to keep records to show that you've made multiple attempts, be a minimum of at least 2, to get that verification of the elevated blood lead level, either from the health department or that healthcare provider. We want to make sure, as we talked about, that our goal here is for immediate verification. So we want to make sure everything is done expeditiously and that we have a paper trail to document that you made every attempt to make sure that happened in a timely manner. So sometimes we will have an issue with that index unit where the child with an elevated blood lead level is occupying. What if that child has moved by the time that you're receiving that notification? So our EBLL response is going to apply regardless of whether the child is or is not still living in that unit. So we're going to continue to take those steps on the index unit to determine if we have a hazard in that unit. Because we are collecting information, we have health information as part of this, we need to make sure that we are protecting the privacy of that household. So we're going to be talking about notifications to HUD as part of this. We need to make sure that when that information is sent to HUD or the PHA, that communication back and forth, that we're not including the child's name or the blood results as part of that. If we were including any of that, it would need to be done in a secure manner. So we have to protect personally identifiable information. There is, for PHAs, there is a privacy protection guideline notice that was issued a number of years ago that it would refer you to on the standard steps that should be taken as part of that. And so again, if you're going to be transmitting any personally identifiable information, we need to make sure that's done in a secure manner. It could be done with encrypted email. So our first step we talked about in getting confirmation. Once that has been confirmed, then we're going to be moving into our notification and investigation step. So once we have received verification of that elevated blood level, then we have notification of 3 entities that needs to occur. Now, and that includes the local health department, or your local field office, HUD field office, and then also the Office of Lead Hazard Control in Healthy Homes. And we've provided that there. We have an email address here. So in some cases, that information about the elevated blood level is coming to you from the local health department, but in other cases, that information came from a healthcare provider, and so we need to make sure that they are going to be notified. So again, our responsibility, our designated party, is going to be the public housing agency when we're talking about public housing units. If it's project-based assistance, those responsibilities are held by the owner. So that our notification needs to be sent out to both the health department and HUD. The timing on this, again, we've got, as you'll see as we go through these, we have very specific timing requirements on this. And so that needs to be done within 5 business days from the point that you receive that verification. So, you know, thinking about, you need to have a process in place. You need to be able to kind of track, when did I get this report? When am I sending out those notifications, to make sure that you're going to be in compliance with that. HUD recommends using an email as part of this, and again, we're protecting that personally identifiable information and the health information, so we wouldn't include the child's name or test results. And we do have a sample notice of verification of the EBLL, which is, we've provided a link here, and will also be included on our resource list we'll be talking about at the end of this training. So in that notice to HUD, depending on whether you're a PHA, if you're a PHA, you're going to be including your code and the name for the PHA. For project-based assistance, it would be the owner's name and the address of those units. It would be the date of the test results, and then identifying the housing program that is triggering this requirement. And in cases where we've got a multifamily property, we will be including the name of that development. And they're going to be verifying whether the PHA or the owner has already notified that local health department on that, or in some cases, as we mentioned, that local health department may have been who initiated this, and so we would identify that they have notified us and the date when you receive that notification. So our next step after handling our notifications is to begin that investigation. And we mentioned that in this case, we're going to be doing a risk assessment plus some additional steps which are comprised in our environmental investigation. So the designated party on this, who's responsible for this, for public housing, again, it's going to be the grantee, the public housing agency. For project-based assistance, it's going to be the owner. And we're going to be utilizing a certified risk assessor. So as we talked about on identifying where we had qualified staff, either internally or somebody that you were going to procure, we need to make sure that we had a certified risk assessor available. So that risk assessor is going to be performing the environmental investigation, which is a risk assessment plus some additional interviews, some additional determination of other environmental factors, and that needs to be completed within 15 calendar days of receiving the report. And so, that's why we mentioned up front about identifying where those risk assessors were, and we'll be talking about as far as a planning step on going through procurement in advance. So we're able to have them on board, be able to task them immediately with that risk assessment so we can get that moving as quickly as possible. Again, we provided the link for the EPA website to be able to determine where we have qualified assessors. And then on our resource list, there's a sample request for proposal for an environmental investigation, which would be helpful if you're going through procurement on this. And then there's an environmental investigation checklist, which will walk you through all the elements that would be part of that environmental investigation. So let's talk a little bit about risk assessors and inspectors. So again, that environmental inspection needs to be performed by a certified risk assessor, and they are qualified to be able to perform the environmental investigation. They could also be doing inspections, your clearances, screening risk assessments as part of that. And that certification is making sure that those inspectors have appropriate training in place. There is a really helpful, we have a couple of the newest resources are a series of videos, and there is a video specifically about the lead-based paint risk assessment. It really walks you through that process. I think that might be very helpful for folks, so I'll just point out that resource. All right. So some of you may be saying, well, is this something that the local health department could do for me? And in some cases, the answer would be yes on this. So in some cases, I know in the state that I worked in, that when we had an elevated lead level, that the health department essentially automatically took charge on this. So in some cases, your local health department will have the capacity to be able to conduct that environmental investigation, and you would be able to rely on that as part of fulfilling the requirements on this. So we're encouraging you to, as part of your planning on this, reach out to your health department, determine whether they have those services available for you on that. I know some grantees have said, their health department responded back and said, we don't have the capacity to handle all of these, and so it would be the responsibility. In other cases, the good news was that, they were ready and able to be able to do this. I will just reference in the lead guidelines that we're going to be referencing at the end of this training, Chapter 16 walks you through that environmental investigation and will give you more details on that. And then lastly in this section, just want to point out, so for our, when we're doing our clearance testing, when we're doing our assessments, we're going to be looking at what we consider to be a lead hazard. And so these were updated in 2020. There was a little bit of a delay in effective date for EPA authorized states. Those are now also, as of January of this year, also are enforced. So our new standards for carpeted floors is at 10 micrograms per square feet. We also have the same requirement for our hard floors. We have a separate standard for interior window sills of 100 micrograms per square foot on this. There also are standards for bare soil where we're in a play area, and then which is more restrictive, and then bare soil in a non-play area on that. The lead safe housing rule does not require you to test water, but that is a potential source of lead hazard, and so there also are standards in place for water. All right, Chris, this brings us back to your section. Do we have anything from the Q&A that we want to call out here?
I'm looking because it just lit up for a question. Okay, so someone's asking about visual assessments. I think they're talking about ongoing maintenance. Is the expectation for the assessment to occur on the same day every year? I think you just need to have a schedule in place. I don't think it has to be exactly the same day, but I would have a schedule in place to do that. Okay, that seems to be the only question right now. It's pretty quiet with our group today, but that means everybody's listening and paying attention, and I would prefer that people pay attention to what we're saying rather than following the Q&A list. And I don't know if we mentioned it, but tomorrow there are office hours where we do go over any questions that were asked today, as well as new questions that you have that come up tomorrow, and we'll go over the homework as well. So thanks, Les, for getting us through environmental investigation. He talked through how do you find that risk assessor, and we've ordered that EI. So now we have the results of the environmental investigation. So what do we need to do? All right, so upon receiving those results, the Public Housing Authority for public housing, or the owner for project-based assistance, has 10 business days to notify HUD and 15 calendar days to notify the family that's residing in that index unit if hazards have been found. And they have to also notify other assistant residents of results of that environmental investigation, but they're not to identify the EBLL family. You will start to see calendar days and business days. This is not inconsistent, it's just how it's written in the regulations. So some things are business days, some things are calendar days. So like Les said, there's a lot of different timelines to keep track of. We do have a summary slide at the end that kind of covers all those as well, but really important to pay attention to how quick some of these things do need to occur. So this notification is delivered to each assisted unit. First, it's provided to the household, the index unit family, and then the other assisted units are also notified by. There is no central posting for this. It is provided directly to each assisted unit that there was an EBLL child identified in the property, and that there will be further steps taken, such as, and we'll go over what those further steps are, but this notification does need to happen, again, within 10 business days to HUD, the field office, and 15 calendar days for the residents. So because the environmental investigation is only valid for 1 year, the notices that are sent to HUD, the family, and then the other building residents, other assisted building residents, have to include the date the environmental investigation was completed. So we want to make sure we have that date on there because it's not valid after 1 year. So did that environmental investigation identify lead-based paint hazards in the index unit? If the answer to that is yes, then the PHA for public housing, or the owner for project-based assistance, is responsible for controlling and clearing all hazards from that housing source. If it did not identify lead-based paint hazards in the index unit, then that ends the response for the Public Housing Authority or the owner. They do need to be notified the results, so the results would say, it wasn't the unit that's causing that. It would identify, hopefully identify what the source is, but it would not be that particular unit. The grantee would need to maintain records of the environmental investigation, the results, and the notification. So the environmental investigation will identify other household sources of lead that's discovered as part of the investigation. So if it wasn't lead-based paint, Perhaps it's coming from the water. Maybe there's some kind of take-home exposure. Maybe the job that one of the parents has is being exposed to lead. Perhaps it's some type of folk remedy. But if it's been identified in that environmental investigation report, there will be recommendations provided. And so the PHA or the owner is encouraged to assist the family directly. They're not required, but they are encouraged to assist them, to look at the report, to help them figure out ways to eliminate that non-lead-based paint hazard that was identified in the report. The health department is also a really good resource. The health department often assists with the case management of EBLL children. All right, let's do a real quick knowledge check. This is going to come up as a poll again. So what sources can verify a reported elevated blood lead level? Is it a healthcare provider, public health department? Is it HUD? Is it A and B? So pick what you think is correct, and then please hit the submit button.
Looks like we may have the wrong, at least on my screen.
Oh, you're right. Okay. Kate, are you able to put up the other poll?
Yep, just give me one moment, please.
Okay. Good checklist. Thanks for seeing it. I think while we're waiting for that poll, I can look at a question here saying Les showed a link to the video of the risk assessment process. It's not on our copy of the slides. It is actually at the end of the slides. We have the links there for the videos. We actually have a couple slides that show some of the videos that we just did. So when we get to the end of the materials, you'll be able to see that we had that link there for you. All right, looks like the poll is up now, so hopefully you see it on your screen too, so choose what you think is the correct answer. All right, great job. So the correct answer is D, A and B. So almost all of you got that correct answer. Once I get control again, I'll circle that on the screen. Get rid of that red. I don't really care for the red. I always feel like I'm marking things wrong there. Let's use the pink today. All right, so A and B is the correct answer. So a healthcare provider and the public health department can verify a reported elevated blood lead level child. So good job, everybody. All right, so if lead is identified in the index unit, remember our index unit is the unit where the child with the elevated blood lead level is residing. What do we need to do next? Well, we need to control and protect. We need to control the unit from the hazards, and we need to protect the household that's living in there. So this is going to be done by certified workers, firms, depending on the type of work that's going to be done. So it's either going to be abatement or it's going to be interim controls. So for public housing, it's interim controls unless you're within comprehensive modernization, and then you can do an abatement. For project-based assistance, you'll be doing interim controls. And so if you're doing abatement, you're using a lead-based paint abatement firm. If we're doing interim controls, we're doing workers and firms who were trained in RRP, the renovation, repair, and painting rule. Abatement firms also have that RRP certification, but they have a higher level abatement certification as well. So we're doing our lead hazard control work. During that lead hazard control work, they're going to be following safe work practices. There may need to be occupant protection, where the household might need to be temporarily relocated. Their belongings might need to be protected to make sure that they don't get additional dust or debris on them. We're going to need to be achieving clearance after the work is performed, and then the proper notification. So our notification of evaluation, that would be given after that environmental investigation is done, and then we would have the notification of lead hazard reduction activities that would be done after clearance was achieved. So this responding, addressing to that index unit needs to be done within 30 calendar days of receiving the environmental investigation results. We do have some guidance here. All these links here are going to our toolkit. So we'll show you a slide. I'm thinking now in the future, if we redo this training again, I might put the toolkit and some of these resource slides early up so that you would know where these links are going to. But we do have a toolkit that talks you through the Lead Safe Housing Rule regulations as well as EBLL response. And these are different links off of that toolkit. All right, so we have lead-based paint in our index unit. Now what do we have to do? Well, we actually have to do testing and perhaps lead-based paint hazard control in our other coverage units if it's identified that our other coverage units also have lead hazards in them. So there is this additional responsibility for us to do a risk assessment on our other coverage units. So our other coverage units are our other HUD-assisted units in the property that have children currently residing, children under the age of 6, currently residing or expected to reside in those units. Those are our other coverage units. So we've identified lead in our index unit. Now we have to do a risk assessment of our other coverage units. If we identify that those other coverage units have lead and lead hazards, those are also going to need to have lead hazard control work on them as well. And again, we have some resources here that you can access. The request for risk assessment of other coverage units, there's a sample there for eligibility levels, and then we also have a log, like a tracking log that you could access and use as well. There was a PIH notice 2017-13 that came out in 2017 that mentioned that covered dwelling units might be exempt. So these other coverage units might be exempt from needing a risk assessment if one was recently performed and the hazards were already controlled. So it's really important we keep talking about record keeping, keeping track of these records, having them available. If these other coverage units recently had a risk assessment and lead hazard control work, then you may not need to do this risk assessment on these other coverage units. That was PIH Notice 2017-13, if you want to reference that. So depending on the size of the property and the number of other coverage units, the Lead Safe Housing Rule allows PHAs for public housing or the owners for project-based assistance to do a risk assessment on random sampling of other coverage units in the property rather than having to do a risk assessment for all of the other coverage units. So sampling is permitted on properties that were built before 1960 if there is more than 20 other coverage units. If you are working with properties that were built between 1960 and 1977 and you have more than 10 other coverage units in that property, then you can also do sampling. So it depends on when it was built and the number of other coverage units as to whether you can perform sampling or not. But you're thinking, Chris, why do you keep talking about sampling? How do I even know what the sampling is? There is a table in Chapter 7 of the HUD guidelines for the evaluation and control of lead Base paint hazards in housing, we're going to show you a picture of what this guidelines looks when we get to the resources. But this, in Chapter 7, gives you a table at the end that has the sampling guidelines. So it'll say if you have 30 units, this is how many needs to be sampled. If you have 50 units, this is how many needs to be sampled. So it does give you sampling guidelines. Your risk assessor who is conducting this risk assessment will also design and implement that sampling protocol. So this is an option to do sampling. It is a little more affordable, but you can choose to do a risk assessment on all of the other coverage units rather than a sample, but it is an option available to you. All right, so if you don't know what a risk assessment is, it's an evaluation that needs to be done on these other coverage units. It's done by a certified risk assessor. They are looking to identify the deteriorated paint. They're trying to figure out what the extent and the causes are of that. They're also looking at the background information on the dwelling unit as well as the patterns of the household that lives there. And again, for this risk assessment, we're looking at units that have children under the age of 6 that are residing there. The risk assessor is going to be testing for the presence on each of the friction and impact surfaces with deteriorated paint. They're going to be getting dust samples from windows, windowsills and floors. They're going to be doing soil samples. We have another link here. Somebody was asking about the link for lead-based paint risk assessments highlight video. When you download these slides, you should be able to click on that link and it'll go right to the videos. If you can't, if you can't get it to work, you just go to the HUD Exchange. You get to the lead-based paint landing page, and we have a link off of that landing page to get to the highlights videos as well. So these videos are brand new, really, really helpful as a grantee to be able to see what's all involved in a risk assessment. It's not very long. It's like 8 or 9 minutes. It's not going to teach you how to do a risk assessment, but as a grantee hiring a risk assessor, it's going to tell you what the highlights are, so you know what to expect. This is an XRF machine. You can see the picture right here. This picture was actually taken from our videos. It's a non-destructive method of testing and measuring the elemental compositions of the materials in the surface and the substrate. So this XRF machine is used in a risk assessment. It's also used for lead inspections and environmental investigations as well. So after the risk assessment is done, there will be a risk assessment report, and the report contains numerous items, but just to highlight a few, it's the summary of the property, what the results were there lead hazards found, where were they found. This one is really super important, the lead hazard control plan. What are the recommendations on how to address those lead-based paint hazards? It's going to contain the results from the laboratory as well as the data from that XRF machine. The report's also going to contain the XRF performance characteristic sheet. It's also referred to as the PCS sheet for the model that was used in the risk assessment or that lead inspection. If you need more information about the risk assessment report or you need a checklist as a grantee to make sure it was done properly, there is a link there as well that goes right to that toolkit. All right, so if you found lead-based paint hazards during that sampling in our other coverage units, then you can proceed under the presumption that all of the coverage units of similar construction also have lead-based paint hazards. So let's say that in your sampling, you found the bedroom windowsills all had lead-based paint in them and they were lead-based paint hazards. And you can presume that the bedroom windowsills need to be treated the same way in all of the other coverage units. We're going to presume that there are lead hazards in all of the bedroom windowsills, even those units that we did not do a risk assessment in, because in our sampling we found that same issue, and now we're going to presume that it's in that same type of building component throughout my property for my other coverage units. And it goes the same way though, so if we didn't find any hazards in our sampled units, those do not need to be treated. The residents of the other coverage units can be notified of a risk assessment result through a central posting. Central posting means there can be information provided in a common area like a laundry room or the hallways, or it can be done as an individual notification. It can be provided to each household. This notification is a notice of evaluation is what that notification is called. That notice of evaluation does need to be provided within 15 calendar days of receiving the risk assessment results. All right, so did the risk assessment identify lead-based paint hazards in my other coverage units? If the answer to that is no, then we do not need to address lead-based paint hazards because there are none in my other coverage units. All right, so I still need to notify these other households. Again, that can be done in a central area or it can be done as individuals. I'm notifying them. We did not identify any lead hazards in these other coverage units. I'm also notifying the HUD field office of the results. Hooray, we did not find lead hazards in our other coverage units. But remember, my index unit still had lead hazards. That was what triggered me to have to do the risk assessment for my other coverage unit. So I'm still the PHA for public housing. The owner for project-based assistance is still responsible for controlling and clearing the index unit. That's the unit where our child with the elevated blood level is residing. All right, so this is just reviewing some of the timing that we need to be following. So this first bullet here, this is for our index unit. So hazards in the index unit have to be addressed and cleared within 30 calendar days of receiving the results of the environmental investigation. And then my other coverage units, if we identified lead hazards in our index unit, remember that's triggering me to do a risk assessment for my other coverage unit. If I have less than or equal to 20 other coverage units, that risk assessment needs to be conducted within 30 days. If I have more than 20 other coverage units, I have 60 days to complete that risk assessment. And then if I identified lead-based paint hazards during that risk assessment in my other coverage units, then lead interim controls or perhaps abatement need to happen in those other coverage units. And again, 30 days for a property with less than or equal to 20 other coverage units with hazards, or 90 days for a property with greater than 20 other coverage units with lead-based paint hazards. So these are really quick and tight timelines. So that's why Les was saying, you might want to know who the contractors are that can do this kind of work. Are you going to have to train any of your staff to do this kind of work? These are things that you want to have in place. You want to have a plan in place. You don't want to be spinning around for 30 days when some of this work needs to be done within 30 days. So you'll really need to make sure you understand what the requirements are, what the timing is, and have a plan in place in case you need to operationalize this plan. So Les, I think that's my last slide for this section. Is there any questions that came up that we should address now?
Just I'll point out there was a question about asking about, well, if I have, when we're talking about identifying covered units, are we talking just in the building? If we have a property with multiple buildings, are we talking just the building where the child with the EBLL occupies, or is it the overall property? And so our definition on other covered units is units within that property. It's not specific to the building. Again, these are units that have federal assistance, and they have a child that's under the age of 6. So you would have to, in identifying, how many other covered units do I have to figure out federal assistance, occupancy, but look at the overall property, not just that specific building.
Great, thanks.
All right. So let's kind of keep moving. And so in talking about the best practices, it really, kind of the first point goes back to we've got some pretty strict timing requirements. Now, based on who the designated party is may make some difference on that. We talked about the fact that for public housing units, It's going to be the PHA, which of course are going to fall under federal procurement requirements. For project-based assistance, it's going to be the owner that's responsible. So the owner hiring a certified contractor wouldn't necessarily need to go through procurement, but they may need assistance in identifying, you know, who is qualified, getting that in place. So I think pre-planning is going to be an important part of making sure that you're going to be able to meet these pretty strict timelines that are as part of that. So that might be including things like going through procurement or identifying where you have qualified contractors and other vendors that could fulfill the requirements. So, you know, just know that the PHA, the owner, has to ensure that they have a certified lead-based paint abatement or renovation firm that is being hired, that they're going to clear any of those lead-based paint hazards, and they've got a 30-day timeline after they receive that environmental investigation to have that be completed. So pretty tight turnaround as part of that. And just a reminder that, you know, the renovation firms, the risk assessors, are the experts in lead-based paint hazard control and clearance, and so really encouraging owners and PHAs to follow their directions in responding to those lead hazards. As Chris just pointed out, the risk assessment report that's part of the environmental assessment will also include prescribed, you know, things that need to be addressed, which kind of populate that scope of work that's needed for that. So I'm really encouraging that you communicate early and often with those experts. Make sure that you ask any additional questions on anything that you don't understand as you're going through that. That might include things like talking through the sampling option. So we mentioned that in larger properties that we have the ability to do a sampling, so not testing on every single unit perhaps, and so kind of thinking about how that's going to be handled. And then we know that if we have EBLL, or if we have lead hazards identified in the index unit, that's going to then have implications for our other covered units. So getting any early information from that risk assessor as early as possible on what they're seeing on that initial review. So a couple things to mention here as we're kind of planning for it, thinking about that work. Depending on the lead hazards that are being addressed, that may mean that we need to not only protect the occupant of that unit, and keep in mind, many cases we're going to be identifying hazards that are in currently occupied units. So we have to think about how we not only protect the occupant, but also their possessions. So if we're going to do work in that unit, we may need to clear that unit, or at least that work area, and think about, is it possible for us to maybe our lead hazard is in a bedroom, and can we clear that room, move their possessions to another part of that unit, and be able to cordon that off or seal that off until not only the work has been done, but we've also achieved clearance on that. And so some of that pre-planning is how to deal with that. And so in some cases, we may need to temporarily relocate those residents. That might be for overnight, that might be for a few days or a week, depending on the scope of the work that we're being done. We can't leave residents in that unit where we're going to be cordoning off, you know, essential spaces, so we can't leave them in a unit without access to kitchens or baths during non-working hours. If we're going to be temporarily relocating them, we have to relocate them to a lead-safe unit. So that's either something constructed after '78, but it also might be another unit Maybe you've got a vacant unit that's been found to be lead safe, inspected, and we could move that household temporarily to that other unit. We see a lot of folks that are temporarily moved to, a local hotel or motel in the area while that work is being done. So that's part of our pre-planning on this. So I want to talk a little bit about the level of treatment that's being done, and this goes back to the summary charts that we looked at. So for public housing, that priority is on abatement, so doing a long-term solution rather than doing interim controls on this. When possible, we're always going to do abatement. For project-based assistance, this is the owner's responsibility, and the owner's going to be paying for the work that's being done. So that decision between abatement and interim controls is the owner's decision, but it may be as a grantee that you want to talk with that owner about why it would be beneficial to them to do the abatement and reduce the need for ongoing. If we make this unit lead-free, then our disclosure, our reevaluation requirements would go away, and we'd have a permanent solution to any potential hazards on this. So there may be a role for the grantee in advising and kind of counseling that owner to encourage them to consider doing abatement for that unit. So an important point on this is, so when are we done with these steps on addressing when we have an EBLL child? Well, we're not done until all of the hazards have been addressed, so that unit has passed the clearance examination that was completed. That work has been completed by a certified renovation or abatement firm, and we have that clearance report in hand. In some cases, we're going to have, when clearance is done, we'll have a failure to achieve clearance, which usually means that they need to do some additional cleaning on that unit to make sure that all the debris that's been left behind, all the dust and debris, has been adequately removed, and then we would have that unit retested. And so we're not going to consider that unit to be completed until that final clearance where we have achieved those standards in place. So sometimes it'll just be some cleaning. Hopefully it will not be that there's additional hazard reduction work that needs to be done as part of that. So when we do clearance, again, it needs to be done by a certified staff. So that clearance test is going to be done by a certified risk assessor or lead-based paint inspector, and they can't have a conflict of interest with the project. And so we couldn't have a contractor who was a certified risk assessor say, well, I'm going to go ahead and inspect the unit that I have done the abatement or interim controls on, because there would be a conflict of interest there on that testing. In some cases, we're going to have some hazard reduction work that was completed, and then perhaps we're going to have some additional maybe rehabilitation done on that site. So we might be doing an interim clearance at the point that the lead-related work was completed, and then allow a non-lead worker contractor on that into that area. We would then need to do a final clearance again at the end of all rehab or construction on that unit to make sure that at the completion of this, that we can certify that this unit meets our clearance standards. So let's talk a little bit about, well, what's included in that clearance testing. So it's going to include a visual assessment. So we're looking for evidence of unstable painted surfaces, any evidence of dust or debris. We would also be looking at that scope of work that was done for that project to make sure that everything that was identified and that has been completed by our certified contractor, that it was completed in a workmanlike manner. We're also going to then do dust sampling. So this is going to be completed by our risk assessor or lead-based paint tester. They're going to be taking dust samples, putting those into containers, labeling them properly. There'll be a list of where those samples came from, and those are going to be sent off then to a lab to be tested to determine are these indicating that the remaining residual dust levels are now down under our limits, so that this is now considered to be lead safe. And so that clearance testing will not only collect this, they'll interpret those sample results, and they'll provide a report of certification when that has been completed. As we mentioned, in some cases, we find that some part of that clearance testing might fail, and so usually we would then see re-cleaning that it's going to be done, and then another clearance test would be completed before we finally achieve that certification. And keep in mind, we're not going to pay that contractor until their work has been clearance tested and found to meet those standards. And again, there is a video on this that allows you to kind of tag along and in that paint clearance exam process. I think that would be very helpful for that, and we're in our resources at the end going to be providing you again a link for all of those videos that we're mentioning as part of that. So what our clearance testing is doing is comparing those, analyzing those dust wipe samples that have been provided by our certified staff, and they're going to be analyzing to determine, are these at or below our dust clearance levels that have been set to be allowable. And again, if they have not passed that, then we're going to do additional work and then retest before we consider this to be completed. So we're collecting samples submitted to a lab, and then they will conduct the analysis to determine whether these are now acceptable. So sort of on the tail end of this, we also have a notification requirement. So we're notifying folks that that work has been completed, that the clearance has been achieved. So this is going for all assisted residents, but it also will be documented to the field office on both index units and covered units as part of this. So again, our designated party on this is going to depend on whether this is public housing or project-based assistance. So it may be the public housing agency or the owner. And we're going to be providing that within 15 calendar days. And then that's for the residents. And then we have a separate standard for that HUD field office. It's within 10 business days. So Chris pointed out we've got different standards and different ways of counting between calendar and business days. This is the perfect example of that. So we have some options on how we would provide information for residents. We could do this in a central posting. Might be, if we've got one lobby where all of our residents are going to be accessing their units coming through there, we may be able to post there. We might have in each building where residents are going to be entering, or some other common space in that property. They could be posted there, or they could be individually distributed to each of our assisted units. So we're going to take another knowledge check here. So when is the lead hazard reduction considered to be completed? Is it when we've passed our clearance evaluation? Is it when the construction is completed, or when the hazard reduction work is completed? If you'll choose your best answer here and hit the submit button. All right, so our poll has ended. We'll see how folks did on this. The correct answer here is A, when the unit has passed a clearance evaluation. So That clearance evaluation is going to be done after all construction is completed, after the hazard reduction work has been completed, but we don't consider this overall project complete until the clearance evaluation comes back and verifies that we now have a lead-safe unit, that our dust wipes or samples in combination with that visual assessment have determined that this unit is now be considered safe. All right. So kind of going through the summary of actions when we have a lead-based paint hazard that has been found. We're going to be notifying all of the residents in the assisted units. We're also going to be notifying the HUD field office. We talked about protecting those families in their units and their possessions. We're going to take our either abatement or interim controls will have been completed, and we will have achieved clearance as part of that. We're also going to make sure that we continue to follow the requirements on maintaining that housing as lead safe. So we talked about visual assessments at turnover and on an annual basis, but also our requirement when triggered of reevaluating those units, of having a risk assessor reevaluate those units. And so once we've completed this, our EBLL response is complete, and of course we're going to have complete files that we're going to maintain to document that we have followed those steps. So we've been kind of individually calling out some of these steps and showing you the timeline. So this is just a summary slide that's walking you through from the point that you're getting verification about having a child with an elevated lead level, starting with our notification, then our completion of the environmental investigation, our risk assessments then of the covered units, our completion of the lead work, any interim controls or abatement that's being completed, and then at the end, our notification of the clearance going to both the field office and also to the residents for that. So you can see, as we talked about, that sort of planning ahead for this, thinking about how you can speed this up, roles and responsibilities, and then taking any steps in advance, such as any procurement that might need to be done in advance, so you're able to immediately take action as required. So we want to close this out talking a little bit about some of the next steps, and we want to go back over the many resources that we've been talking about. So first off, we want to make sure that folks are doing everything they can to follow the lead safe housing rule, so ensuring that lead-based paint is being tested when it's required, that they're keeping all of the records. Chris pointed out, we may have some exceptions on this when you already have records to show that you have units that have been found to be lead-free. And so wanting to make sure that we keep all of our information, we'll need that as part of our disclosure of what is known about units, work that has previously been done. So a good filing system, and sometimes passing that off to the next generation of folks who are going to be in charge of that. We've talked about planning for lead evaluation, hazard control work, whether you have existing staff, whether that's something that you're going to be contracting for, whether you're going to need to work with those owners to help them identify contractors, other certified personnel that would qualify for that. And that would include things like we mentioned about the visual assessment, that there's an online training, and that could be owner staff, could be grantee staff that would have completed that in advance and have that in place. We mentioned about making contact with the local or state health department. We mentioned that in some cases we may have state health departments or local health departments that actually are able to complete that environmental investigation for you. And so knowing whether that part of this protocol is going to be handled by another party would be important. And then we mentioned about informing residents about the risk, about written notification to them that we want them to keep an eye out and notify you when they notice any unstable paint surfaces, any potential hazards that they would notice. So we want to talk through our resources. So on the HUD Exchange, there is a what we call a landing page that is dedicated specifically to lead-based paint. Here's the address for this at the bottom of the screen. And so this would really be the go-to spot, not only to get into the toolkit, which we're going to be highlighting a little bit further in some of the other resources, but also if you wanted to pull up the lead regulations themselves or each of these guidance pieces that we've talked about, this is sort of the go-to spot. So on that page is where you would access the Lead Safe Housing Rule Toolkit. And you'll see, or you may be able to see on this slide as a projection on your screen, that section by section, the different subparts, the types of actions that you were taking, there are subparts of this toolkit which will identify existing resources. So where there's a sample form of a report or a sample notification form, those links are identified in each of these sections as they're talking about that particular topic. And so I would encourage you, if you're not familiar with this, to spend a little bit of time with this, identify those resources that may be helpful for you. As part of that, we've been pointing out about a number of these videos, and so there is on that lead landing page, there is a specific link where you would find all of these videos that we've been talking about, taking you through the lead paint inspection process, a resource on the environmental investigation that I think will be helpful for you and your staff, maybe for owners of properties to kind of add to their understanding. And I think one that I found really interesting was this family interview on the environmental investigation. It kind of walks you through that process. I would highly encourage you, if you haven't seen this one, to take a look at that. Also, I mentioned about the guidance and performance criteria. So this is sort of the go-to guide. There are two versions of this. One that's a technical manual for evaluation and control that's for federal housing. Also, it includes guidance about the EPA's rule and overlay on this. And then we really encourage you to sign up, if you haven't already, for the Lead Safe Housing and Healthy Homes mailing list. And so, as additional guidance, a number of these things we pointed out are pretty new resources. So any new guidance, any new resources or tools that are coming out, if you've signed up for the mailing list, you would then get updates or links that would be sent to you. A lot of you probably are already signed up on the HUD Exchange, but you may need to go back and update your preferences to include lead as one of the topics that you need to stay up to date on. And then we've got a separate list of direct links for resources on the HUD.gov, resources of the regulations themselves. As I think Chris mentioned, there's been quite a few Lead Safe Housing Rule trainings that have been completed, and those are posted on the HUD Exchange. We've also provided the link to the EPA website. One of the things I wanted to mention is the interpretive guidance. So these are topic by topic guidance that take you into more detail. I've found these really helpful. And so I would recommend you take a look at those, familiarize, and that's something I think that you would be likely to go to at different points when you needed a little bit more on any particular topic. Again, here's the link for the toolkit and also for the videos. I'll just point out here our contact at the bottom here. So Chris mentioned we're going to have office hours tomorrow, and so we're going to be available to you to answer more questions and kind of go back over some common questions. But after this training session is done, this email address can be used to forward questions that you have and seek guidance. So I would suggest that you kind of make a notation of that resource for future usage. All right, Chris, do we have questions that we should discuss, or do you want to tell people about the upcoming training?
Yeah, we can. I haven't seen any new questions come in. There were a couple really specific questions that Bruce had used that email, the lead regulations at HUD.gov, for them to be contacted because they're really specific, and in the Q&A box you only have so much information you can provide. I do want to talk a little more about tomorrow first. Tomorrow is our office hours. Like you said, Les, we're going to answer questions, but we're also going to review the answers to our homework. So you should have received a link for the materials, all those handouts that we've been showing at the top of the screen here, but you should also receive homework. And so it's just a one-page, asks you some questions. Hopefully you have some time either this afternoon or tomorrow morning to go through and jot some answers down, and we'll review the answers to that tomorrow, and then we'll go over any additional questions you have about EBLL or Subpart H or Subpart L. We are going to be doing a repeat performance of Subpart H and Subpart L in February. So we did train that, I think, this fall. It's been a really busy training season for Les and I, so I apologize if I don't remember exactly when we did it. But this is elevated load levels and the amendment that we focused on now, and we breezed over in about 15 minutes the general rules as they apply to Subpart H, project-based assistance, or as they apply to Subpart L, public housing. But we have was it 3 hours last? 2.5, 3 hours?
I think 3.
3 hours training. So if you were a little shell-shocked when we went through it very quick, we do have a 3-hour training that goes into great detail, specifically for project-based assistance or specifically for public housing. Those are going to be February 7th and February 14th. One will be one date, one will be the other date. I don't know which is which right now, but there is going to be registration sent out. If it hasn't come out yet, it's coming out in the next couple of days, so watch for that, and you'll be able to register for that. But if you already attended it, if you got to hang out with Les and I for 3 hours in the fall, it's the same training, so you don't need to come to it again. It's the exact same information. But if you were new to this today and you did not get a chance to attend our fall training on Subpart H or Subpart L, it is going to be offered again in February. And that'll be the same thing where it's 1 day of training, and the next day is our office hours where we go over homework and we try to answer any questions that you have. So it just really gives you a good opportunity and some access to us as well as to HUD staff, because we're really fortunate to have HUD staff be available with us on these webinars. So not all HUD offices provide that support, and you're really fortunate to have that from the Office of Lead Hazard Control and Healthy Homes. Les, did you see any questions that came up that we haven't mentioned yet?
Just looking. I think everything's been addressed here.
Okay. Well, no need to keep people hanging on. I'm sure they'll be super happy to have a couple minutes before they have to hop on another call probably after this. So thank you, everybody. Thanks for joining us today. Really appreciate you taking the time. Hopefully we will see you tomorrow for our office hours. Thank you to Kate Stegner, who's our webinar host today, and to our HUD staff, Bruce Haber, Karen Griego, Flora Chavez, Barrett Fisher, and thank you, Les, for being a terrific co-trainer today. So always enjoy working with all of you. So hopefully we will see you tomorrow. Thanks. Bye.
Thanks, everybody.